The freezer-packed COVID-19 vaccine vials are making their way to distribution sites across the country. The rollout of the FDA-approved Pfizer vaccine ushers in the biggest vaccination effort in U.S. history, and it comes as the nation's death toll nears 300,000. So for more on this, Errol Barnett joins me. Errol, so give us a sense, do we know just where the vaccine shipments are headed this morning and what the timeline is going to look like, as to where they arrive and when they'll arrive?
Sure, Anne-Marie. Well, I'm in Troy, Michigan. This is near a location where the vaccine was distributed from just yesterday. And as we speak, it's being sent to distribution sites across the country. This is just the initial batch of some 3 million doses. Today, it will arrive at 145 distribution centers. It will arrive at more than 400 on Tuesday and some 66 on Wednesday. And from there, it heads out to healthcare facilities, really reaching all across the country. They calculated and figured out where exactly to send the vaccine based on each state's adult population, and each of the healthcare facilities needs to be able to hang on to the vaccine because it has to maintain a temperature of 94 degrees below zero. All the sites that are a part of this will likely receive, if it's on the front end of the batch, doses today. So we expect this rollout to take a few weeks. The federal government says most of the facilities will receive this first round of batches within the next 3 weeks. But as these days go on here this week, we'll start to see it distributed nationwide, with the first folks getting it today.
So you recall, much was made of the first person to get the vaccine in the UK. It was an elderly woman. Health officials here are hoping to start immunizations today. Who will likely be among the first?
Well, this first batch is just for frontline healthcare workers and nursing home staff and residents. So that's who we expect to be a part of this very first group. And what's likely, Anne-Marie, is that if you are a healthcare worker selected to be among this group, if you've agreed as well, then you will have likely already received a text message or an email. We know that there are some healthcare facilities in the process of getting their staff vaccinated today. And of course, let's not forget, because of the suspicion some people have about receiving a vaccine that was approved so quickly, they, as was the case in the UK, want to convince the general public that this is safe to take. And so that will likely mean we can expect to see press conferences and healthcare workers kind of describe what it's like receiving the first dose of this vaccine. But those frontline healthcare workers, Anne-Marie, are among the first folks to receive this today.
You know, throughout this whole pandemic, we've really heard from healthcare professionals and the heartbreaking stories about the types of sacrifices that they have made, how they are fearful at times when they come home from work that they may expose their own family, that they are being called upon not just to treat people suffering from COVID, but also often they're the only people there when people succumb to the virus because loved ones are not allowed in the hospitals. I'm wondering, now that it appears as if we're sort of reaching a turning point here, what are you hearing from health professionals? What's the mood like with the knowledge that, a vaccine is about to be administered?
You're right. We cannot overstate just how much nurses, doctors, and other support staff at hospitals have been through in 2020. It has been not just devastating for the country, but really devastating for those on the front lines. I spoke with Dr. Richard Pfizer, who leads one of the largest nursing home facilities across the country called Genesis, and he told me on Sunday that this vaccine just could not arrive fast enough. I mean, everybody is exhausted, and the numbers are depressing as we approach 300,000 American deaths. But he says there is now a renewed sense of optimism, a sense of momentum, and a sense of hope as the first doses just start to get distributed across the country. It's still early days in this process. He explained this as like a plane still being put together as it's flying, but at least now they have something to work towards in getting these vaccines administered to healthcare workers, staff, and even explaining that there will be some side effects, muscle muscle soreness, a slight fever, and that's to be expected, so that that sense of optimism maintains as this continues to be distributed.
Yeah, well, knowledge education goes a long way when it comes to making sure that people are not hesitant about taking this thing. Errol Barnett, thank you so much.